Percentage increase in immune activity, NK cell activity. This is transfer factor, ordinary. Another transfer factor, 200. But the transfer factor for life, which is transfer factor advanced, there is increase in NK cell activity by 283%. And the transfer factor plus, I think the best product is really in dark blue. This is transfer factor plus. Transfer factor plus, it increases the NK cell activity by 437%. Imagine that. This is interleukin. Interleukin is an injectable form of, galing sa WBC yan. Per injection, that is 5,000. And you have to be injected every day to get 389%. So 5,000 kada adlaw, you get 389%. So ang ito, capsule lang, iinumin mo lang ng capsule, you will get higher result. 437% increase in NK cell activity. So if you have high NK cell activity, cancer is down. That's why you should take this one to prevent or minimize cancer. Hindi yan sabi ko, study nila yan, 11 years. Ito naman, this is according to JANA test result. JANA means Journal of American Nutraceutical Association. They have a 7-year study on 198 products, ang daming ingredients. And top 8, ito yung mga top 8, noni. Di ba uso yun yung noni juice? Saan ba galing yung noni juice? Anong tawag ng fruit na yan?
Noni plant.
Noni fruit, apapot pa yung tawag na? Apatot. Baho, no? Noni juice. Uy, 15% lang man i-increase niya na. Aloe vera. Anong ka? Ikaw nagsabi nun na, forever living aloe vera. So, 15% naman di ay. Bovine cholesterol, 23%. Oh, meron din isang produkto dyan, ang daming mushroom. The coffee contains all kinds of mushroom there. Shiitake mushroom, 42% lang. Echinacea, 43%. But look at the transfer factor advance. Itong advance is the light blue, 283%. And the plus, which is the dark blue, imagine, 437% increase in natural killer cell activity. So this is so far the best in the market. Advance, 389%. Interleukin pala to, 389. Then the transfer factor plus advance, 437%. This one, you have to be injected every day, 5,000 per injection to obtain 389% increase. While this one, you just take the capsule, you get even higher result. Sa Russia, they tried giving transfer factor in their inpatient. No? And they noticed na yung sa mga hospitalized patient nila, ang bilis ng recovery. That's why they make it into their law that transfer factor be available sa pharmacy in Russia. So if you go to Russia, you happen to be admitted there, transfer factor is available in their hospital pharmacy. Unfortunately, dito sa Philippines, sa sobrang strict ng BFAD, lahat ng food supplement, bawal. Kailangan palagyan ng no approved therapeutic effect. So, lahat ng food supplement, it is a law only in the Philippines. All countries around the world, all food supplement, according to the Philippine law, should have a label, no approved therapeutic label, para ma-approve. Otherwise, you should have an under-the-table, no approved therapeutic label. Yes, that's the Philippine law. Siguro, that's part of it. As you can see, it's very effective. Even in the States, no, sa physician's desk reference, transfer factor is available there. So now I'll talk about evidence-based medicine. The doctors would really need this, no? I'll just share to you what evidence-based medicine is. It aims to apply the best available evidence gained from the scientific method to the medical decision-making. So, ibig sabihin, before a doctor writes a drug or a certain prescription, it should have evidence-based. Ano pa ibig sabihin? Dapat may ebidensya, for sure. For life, meron silang 11 doctors. These are all renowned doctors in their Medical Advisory Board. 2 even are oncologists, Dr. Townsend, our gynecologic oncologist, and Dr. Yes, pareho sila OB-GYN oncology. And ilahang chief, si Dr. Kao Makuslan, who happened to be here last year, April, siya nag-inaugurate nito, kaya nandito siya. Pangtag, ano? Okay, mga Amerikano lahat yan. Ito, Amerikanong hilaw. Okay, so levels of evidence, there are 3 levels. Level 1 is RCT, or what we call randomized controlled trial. Ang ibig sabihin lang yan, randomized controlled trial. The one doing the study of that drug doesn't know kasi randomized. Hindi niya alam which patient is taking which drug. So, hindi siya bias kasi hindi niya alam, you know? He base it according to the result. Pag level 2 naman, randomized, medyo may bias konti kasi yung the one who's making the study knows which patient is taking which drug. So may konting bias ito. And the third level is level 3, basing on expert opinion. I would say, oh yeah, I'm an expert in that. That is a very good drug. That is expert opinion. Bias yan. Eh kung binayaran yung gumawa ng study, sasabihin niya maganda na yung drug, di ba? Unfair. Testimonies from your kapitbahay, from your friends, are also called level 3. So among the 3, which is the best? Level 1, kasi randomized siya, no? Walang bias.
Yan din yung double blind study.
Yes, double blind is even better kasi blinded siya, hindi niya alam, no? Walang bias. Sa categories of recommendation naman, pag sinabing category A recommendation, kunyari there are 10 doctors in the panel of experts, 75 would agree that the drug is effective. Pag sinabing level 2, category B recommendation, controversial yan, 50-50 doesn't agree. So hatik sila. And if it is category 3 recommendation, do not take the drug because they have disagreement that the drug is effective. So the best is category A. Level of evidence, level 1, category A, and sa phase of study naman of a certain drug, we have phase 1 which is in vitro. Ibig sabihin ng in vitro, laboratory pa lang yan, Petri dish. Tinatry doon sa Petri dish kung effective. If it is effective, we try it on laboratory animals, rats, monkeys, mice. If it is effective, we go to the phase 3 which is the human study. So the best phase of study is phase 3. So we're looking for studies or journals in the medical study that it should be level 1, category A, and phase 3. So ito testimony. Testimony is considered level 3 evidence lang. So sa dami ng mga testimony that transfer factor is effective daw. But it's only level 3. Bias siya. Kasi sabi ng kapitbahay. Do you think there are people who shouldn't be taking transfer factor? I've been talking about how good transfer factor is. But do you think there are some people who should not be given transfer factor? For those who have been in my lecture before, do not answer. To keep the suspense. For those first-timers, you can answer. If you can answer, I'll give you another glass of Rio Vida. So there are actually some people who should not be given transfer factor. Who are these? Yun. Transfer factor cannot be consumed by those with organ transplant. So kunyari may kidney transplantation. Yung kidney, hindi man galing sa kanya, galing sa for other people. So from other people, they're given a kidney, they're taking immunosuppressant para hindi nila i-reject yung kidney na binigay sa kanila. So this patient is taking immunosuppressant, and here you are, binigyan mo ng immunoactive, and what happens? The immune system becomes very active, ni-reject na yun yung kidneys. Naku, sayang yung 500,000 worth of surgery. Pati yung kidney na reject, sayang. It's because of your fault. Yeah, do not give this to organ transplantation. But actually, do you know what? Organ transplantation during the first few months, because they're taking immunosuppressant, a lot of them die from sepsis or infection. The mortality is not due to rejection, but due to infection. A lot of them die from infection and sepsis. Grabe ang infection yan. Because they're taking immunosuppressant. They suppress the immune system so that hindi nga ma-reject. Hindi nga ma-reject, namatay naman sa infection. Too bad. So just remember, don't give it to organ transplantation. So here are some of the studies which I've searched in the journal. Chemotherapy in pulmonary tuberculosis. We know that because the first patient who actually benefited from transfer factor was a TB patient of Dr. Lawrence. So although this is level 2, category B, successful treatment, severe complicated measles, tick dust. Although level 2, category B lang, I'm using complicated measles. Some babies which are weakling, immunocompromised, they have severe measles, they die from pneumonia. But if you give transfer factor, you strengthen their immune system to survive according to this study. This is done in Mexico. Treatment of childhood Epstein-Barr virus, EBV virus, and cytomegalovirus infection. These two viruses are very common causes of diarrhea. Pag yung mga babies, nagtatain, they try to give transfer factor. Ang bilis ng recovery. Without taking antibiotic. Because your immune system works, ito na yung magpapagaling sa kanya. With antibiotics, sometimes you get all the resistance there is. And who knows, you give antibiotics is for bacteria. Yun palang cause ng diarrhea niya is a virus. Di mali pa rin. You give an antibiotic which is not antiviral. Mali. And these are viruses. So you give antibiotic, it's not intended for that. But if you give transfer factor, the immune system works, it kills virus, bacteria, fungi, kill all siya. Effect on non-specific acting transfer factor on juvenile rheumatoid arthritis. Actually, juvenile rheumatoid arthritis is an autoimmune disease. Anong ibig sabihin ng autoimmune disease? Your own body creates the antibody against your organs, such as the mga joints mo. No? There's antibody against that. That's why you have bata pa, nagkaka-arthritis na, rheuma na. So probably with this one, this is an autoimmune disease. What is the best to suppress that? Suppressor? Transfer factor, advance. So the light blue, just remember, this one is very good for allergies, asthma, autoimmune disease, the light blue. Ito naman plus, if you want it for infection, for cancer, this one is good. Okay? I went through the Medline abstract search. Sus, ang dami na pala mga study. Actually, there are thousands. These are some of the more important ones that I highlighted. Ano ba dito? Okay. HIV or AIDS. You know what is AIDS? Acquired immune deficiency syndrome. So the patient is suffering from immune deficiency caused by this HIV. Ano ibig sabihin HIV? Human immunodeficiency virus. From the word lang immunodeficiency, definitely ang makakatulong is something that would enhance the immune system. The virus destroys the immune system, but your transfer factor builds the immune system. So very good ito. Kaya HIV ngayon, bihira na yung namamatay unless fulminating infection yun. But if you give this to enhance the immune system, that's very good drugs against the virus. Medyo nagsusurvive na. They can just be a carrier and the disease is stable. So now, hindi na masyadong problema yan. What else? Even this one, no? Allergic bronchial asthma. So what is the best transfer factor? The light blue. Because of the middle suppressor segment. It suppresses the hyperactivity of the immune system. Eto, mas interested ako dito. Transfer factor in malignancy by Dr. Pisa. This is level 2, category A. Ito yung mga cancer na pinag-aralan niya. Lung cancer, bone cancer, melanoma, which is cancer of the, not skin, mole, alum, melanoma. Medical term, we call it melanoma. Papillomatosis, nasopharyngeal cancer, very common yung nasopharyngeal cancer of Chinese descent. May bukol yan dito sa loob na palang cancer. Burkitt's lymphoma. Lymphoma are cancer of the lymph node. cervical cancer. Do you know that cervical cancer meron ng vaccine ngayon? Yes. Because cervical cancer, 70% of them is caused by the virus, HPV, human papilloma virus, which causes ulugo, wart, but not specific wart, it's a genital wart. Once you have genital wart and you have sexual intercourse, you transfer that virus to the partner. The partner will have wart. If you have HPV infection in your vagina, in your cervix, you will have cervical cancer. So now if you get vaccinated against HPV, 70% of the time you are protected against cervical cancer. So women 9 years old to 65 years old, you can get the 3 shots of cervical cancer now. Even men, recommended na rin. Yung lalaki, kasi kayo ang source ng cervical cancer virus. So pati kayo, mabakunahan na rin. Yun ang recommendation niya to prevent cervical cancer. Hodgkin's lymphoma, this is also cancer of the